Let's return now to the top story. And if the word of 2020 was lockdown, well, this year, surely it must be vaccines, because we're talking an awful lot about them. Today, the EU is stuck in a very public dispute, isn't it, with one of the world's biggest pharmaceutical companies, AstraZeneca, over supplies of coronavirus jabs. Well, joining me to discuss this is Natalie Mould. She is Director General of the European Pharma Lobby, the EFPIA. Thank you very much indeed for joining us. We've heard an awful lot, actually, indeed, even from the AstraZeneca boss, talking about these teething problems or glitches when it comes to vaccine production. Can you just give us a sense of why it is so tricky to make these vaccines?
Well, first of all, I think we're in a really exciting moment in time, right? Because after just 12 months from finding out about COVID-19, through this incredible collaborative scientific manufacturing logistical achievement, we have some vaccines. And since 1 month, we have some approved at European level, and over 7 million doses have already been shipped to the EU, which I find extraordinary. And we're witnessing millions of people getting vaccinated, which I don't think we necessarily could have foreseen last year. The issue in particular with vaccines, as compared with other, if you like, medicines, is that they are very complex biological systems. So there are lots of variables that can combine in different ways, from the starting materials, which are microorganisms, so living organisms, environmental conditions, the microbial culture in which they're mixed, the manufacturing, the scale-up. We're talking about production in 1,000 to 2,000 litre vats, if you can imagine that. And so unlike, if you like, a chemical process, which you can foresee the timing and the conditions and the outcome quite easily, a biological process is very different. And not to mention all the purification steps and then the verification that the outcome, the vaccine works. So fluctuations have to be expected. Yes, sorry.
So, yeah, I'm just saying then, if that is the case, then wouldn't it make sense that when we've got these vaccines that have been approved, and we've got 2 approved in the EU at the moment, on the verge of a 3rd one, that actually, what other pharmaceutical companies might step in and say, actually, use our facilities. We can help you because it's all for the common goods. Shouldn't that happen more?
That is what is happening. You will have seen yesterday the announcement by Sanofi that they are going to bottle Pfizer-BioNTech's vaccine by the end of the year. So they're scaling up and modifying their manufacturing site in Germany in order to do so. And in fact, the manufacturing of the current vaccines is not done only by our companies. Because of the sheer scale at which we're talking, which is about 10 times what we usually produce, we've had to work with other companies, and we've had to transfer the technology into those companies all over the world to make sure we could boost up manufacturing. So between us, between the pharma companies, but also with a lot of partners, this is already happening. But of course, the time is short. At the moment, as you said, we only have 2 to 3 products. We're hoping for more, and the pressure is so strong because the desire to come out of under this COVID-19 cloud is enormous, and it increases, I think, day by day, considering the losses we see.
I think it's fair to say that there are some people who are mistrustful of pharmaceutical companies, and we've seen this very public row this week between the EU and AstraZeneca. I mean, and today suggestions that they're sending inspectors into a plant in Belgium. How damaging is that potential mistrust, or even the possibility it could get worse between certain pharmaceutical companies and the EU Commission?
I think we've seen an incredible collaboration over the last 10 months. I never in my lifetime of working have I ever witnessed such close collaboration between EU institutions.
But we've also got the AstraZeneca chief calling the EU emotional. So it's not all going swimmingly.
Everybody's emotional right now, right? I mean, I'm emotional sitting here at home. And I'm not even thinking about the people who've been touched personally by this crisis, either their family members or themselves. So I think emotions are fair enough in the moments we're living now, but we have had incredible success working together since the beginning of the pandemic. If you think back at when borders were closed in March and April of last year, and we couldn't even get masks and medicines around Europe because the borders were closed and we had problems. We worked incredibly well together as a team with the EU institutions and all the other supply chain partners. So I'm sure that we can get through this as well. And we all have the same objective, vaccinating as many people as quickly as possible with safe and effective vaccines. And that is what we need to keep in mind. And that is what we need to work on.
Okay. Natalie Mull, thank you very much indeed for joining us there, Director General of the European Pharma Lobby. Much appreciated. Right.